the society, that Giraldo, who draw this model of the kid, is one of the most famous Brazilian cartoonists. So with a technical team, a multidisciplinary team wrote this, and with him decided how to draw the best cartoons and make it like more suitable to read it. So we have some samples, not many unfortunately, but I'm sharing with you in this conference. Like it's very nice to present this for the first time. So as I said before, early diagnosis is very, very important for us. So actually, not only for us, that you can see here, it's the MChat. Okay, so MChat is a screening instrument. I don't know if everybody is aware of it, but it's a very good one and simple and short, very easy to fill out. So we post that in our website, and anyone, like a parent or I know a neighborhood or someone, I can go there and fill out MChat, and in the end, you have the result of it. So if you have a suspect case and you go there, you can be more aware if you say yes, it is. It's a suspect case. So go and search for a better identification, a specialized service, search for a clinician, just confirm that. So, or not, no, it's nothing to do with autism. So it's very popular. As you can see here, it's the most accessed part of our website indeed. Last month we have almost 20,000 site visits on this thing. So I think this is very, very good. As in other countries, as far as I know a little bit from colleagues from Argentina and Chile, instruments are not so suitable for our system. There are some, especially some old times, there's some resistance to use them. But surprisingly, people are very interested in that. When you show them, you give them an opportunity to use it, they use it. To conclude this part, but not less important, I will talk to you about a little bit more social actions which are in our website. So first of all, something that we are very proud of is we have this web consultation. Okay, you live in Manaus, you live in the center of Brazil, you can ask some questions on the website, and it can answer to you. So you have also about legal resource and also about clinical resource. So you have a lawyer, a clinical psychologist, and a neuropediatrician answering your questions, your doubts. So I think it's very important. Another thing is very, very interesting. You have a poster actually about it. Inspiring Autism Speaks Again. We had it's a hard work that Joana Portales did. Okay, there's a map. You can go there, and there's a map of the entire country, and you go each state, and you can find each service is available there. You have the address, telephone number, and surprisingly, there are more than 600 Brazilian services that spread around the country, including family, parental groups of family, public services, private clinics. So it was the first step. We would like to go to each one. We always say, oh, maybe next step will be go to each of them and see exactly what they are doing, but at least now they are listed. And also you can find in our website at least what they have. Like they have multidisciplinary teams or not, they assist adults or just kids. So it's very interesting, my point of view, especially in more like in Buenos Aires, everything is there. If you live in Buenos Aires, it's not a big deal. Like if you live in São Paulo or Rio de Janeiro, Porto Alegre, it's something. But if you live in different regions, it is very, very useful. We also had other activities like event diffusion. Our scientific committee constantly posts some scientific papers. We are a team with 15, I think, researchers, and every month or regularly, one of us choose one like important paper, translate the abstract so parents can see the abstract, and then post the entire paper. So if you are, I don't know, if you're studying during post-graduation in a little town, you can access that. Parents who are more interested in science, it's there also. And also we host a parents discussion list, which is very active. Also, we are committed with capacity building. So in 2012, we had the first Autism in Realidade workshop the main focus was good practice in autism. Um, Shifting to fundraising. So I'm a researcher, so I like to talk about that, but not because even I have this bias. It's very nice to tell you that this first time in Brazil, it was the first research grant specifically for autism. It was launched in 2012, and different from other colleagues, I have been talking to them, and it seems like in Argentina and Chile, you don't have like big agencies to fund, but we have some. In São Paulo, it's a very good one, in Rio, in a national one, but they never launched one specific grant for autism. So Autism em Realidade did that for the first time in 2012, and you probably are launching the second one this year, until the end of this year, the second one. So it was funded 2 projects, one about genetic, another one, but more like capacity building to bring knowledge to primary care providers, how to identify and manage autism, like 300. We're gonna do it by telemedicine. So it's interesting because you can spread that for the entire country soon. Just to finishing, I have 5 more minutes. I'm almost done. I just would like to conclude saying that in my point of view, situation changed a lot in Brazil since I started to study autism in 2005. I remember the first time I went to INFAR, this international conference, nobody talked about autism. There's no research over there. And now the situation is a bit different. You have a lot of studies. We have Brazil, we have a lot of good researchers and clinicians, but autism is kind of new. That's the thing. But because you have the basis, like you have great geneticists, for example, epidemiologists, so it's not so hard to move on, let's say. So, in my point of view, nowadays you are kind of starting to unite NGOs, government, individuals and families, researchers and society. Just to give like some very quick example. We have the guideline now, which is very important. It's just brand new, 2013. We had one from the Minister of Health, like entire country. We have this, and one specific for the state of São Paulo. I can talk about this a little bit because I was part of the team, me and another colleague from Autism em Realidade. So we spent a year, as Chilean did here, a very good job. We spent a year in a multidisciplinary team with researchers, clinicians, people from the government, like social workers, like speech therapists, thinking, well, how it is? How can you write a good document? And then it has 5 main topics: clinical signs, main instruments, evidence-based treatment, which is a challenge. Talk about that, but we really are emphasizing that now, and how the health system is organized. But other things are going on. We are very worried about how to improve the system. There are a lot of things to do. But just to give an example how not bad it is, we have a national system. It's a unified one. So it's different, for example, as Argentina. I can't imagine how hard it is if you are independent. No, you have a national system. And one of the main unit for assist autism is called care centers. It's CAPZ. So just to give you an idea, in 2012, we had only 32 units. Now we have 136. It's not enough, I agree. We need much, much, much more. But it's a huge, it's optimistic view of it. In 2010, we have the first meeting in research meeting about autism in Brazil. Autism Speaks were there. Autism em Realidade was supporting it. So we had people, parents, researchers, and clinicians from all around the country gathering to think about that. We wrote some documents. And the last thing is, this is another initiative, like with a bunch of universities, and we just got this funding, which we are very happy. Have been discussing here a lot how to treat this kid in a cheaper way and a shorter version of which will be feasible in public health system. So we just got this funding from FAPESP, and Autism em Realidade is helping us somehow, unifying 3 universities. The idea is to do a multicentric study about acquisition of social skills in children with autism using video modeling parental training. So it's analysis, apply analysis behavior analysis idea, but you kind of do it short in a videotaping, so it'd be much cheaper and it's more feasible for our public system. We are testing it as a clinical trial, case control, blah, 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 very research style. I hope we have news next meeting. So there is a long, long way to go, but I see for the first time that NGOs, government, researchers, clinicians, parents, individuals are more united. We are doing differently nowadays. And this conference definitely is part of it. And you help us to move us, like Latin America, also get more united. Thank you.